Good morning, good afternoon, or good evening, wherever you are. Today we are going to speak about turmeric. Turmeric, the scientific name of turmeric is a Curcuma longa. The genus name curcuma comes from the Arab curcum, which stands for turmeric, and the species name longa means in Latin long. The plant belongs to the family Zingiberaceae. The synonym is Curcuma domestica vallotton. English name, apart from turmeric, we've got Indian saffron or long-rooted turmeric. In French, it is called Curcuma safran d'Inde, and an old name was Souchet des Indes. In German, it is called Gerwülzel. The parts used of this plant are the rhizomes, which are bright yellow, and this is because they contain a large amount of substances which are aryl heptanoids, including curcumine and desmethoxycurcumine, and other sesquiterpenes are present, and it can be found in a book published by Xigan in 2004. Medical history of turmeric, a very old plant, a very rich history. It was already known of the Romans and the Greeks. Dioscoride and Pliny call it Cyperus indicus. It comes from South India, where it has been used for thousands of years in Ayurvedic medicine. One of the Sanskrit name of turmeric is Harindra, and it was known of the Indian physician Sushruta, who lived in the 6th century BC. Sushruta was really a genius of his time. He identified a lot of diseases and even made some surgery. It is really an important figure in the history of medicine. And Sushruta was using already turmeric. In Ayurvedic medicine, it has been used especially for skin diseases, for pathologies related to inflammation, also used to heal ulcers, as a tonic. Interestingly, a disorder of the blood, jaundice, and many others. And this can be found in the book published by Uday Chandut, Indian physician, a book published in 1877, as well as other British invaders of the time, like Watt in 1889 and Drury in 1873. Turmeric was known of Europe in the 16th century. It was called in Latin terra medica. Terra means earth because it has somehow turmeric powder, looks like some sort of soil. The French botanist Deschamps asserts in his books that Histoire de drogue simple, I think, published around middle of the 16th century, that turmeric is good to open internal parts. It is good for dropsy. Okay, dropsy is a symptom of heart failure, so this is interesting within the context of these lectures. And for cachexia, the French pharmacist Nicolas Lemery, in one of his books published in 1760, recommends turmeric for liver and pancreatic obstruction. We can see that the use of turmeric gravitates a lot around liver, digestive, around inflammation, also for dropsy, diabetes, jaundice, diabetic, and many others, including kidneys, and to expel kidney stones. in 1770, we've got the lectures of Alston, Scottish professor of Mathematica, writes that turmeric is diuretic, useful for jaundice, and also for dropsy again. And turmeric was used in North American pharmaceutical practice at the end of the 19th century as tonic and as a stimulant. Current medicinal uses of turmeric almost everywhere in pharmacy shops and OTCs. We'll go back into that later. It might not be a good idea to self-prescribed curcumin capsules and turmeric. We'll see why. Nevertheless, turmeric is used in Turkey for hepatitis, tonic in Iran, for fever in Sikkim, blood diseases in Bangladesh. In Europe, it is also part of the European Union Herbal Monograph published in 2018. We've got in the Philippines use for diabetes, especially in the island of Cebu, and a bit more anecdotal, it is used for stomach ulcers, but this is not very medical, to protect against poison by black magic, and this is in Papua New Guinea. Let us look into the beneficial effects of turmeric on the aging cardiovascular system. First of all, the effect of intake of turmeric on plasma lipids and glucose. Curcumin given at the dose of 500 milligrams per kilo per day for 7 days to healthy individuals after breakfast caused a decrease of total cholesterol by about 11.6%, increased HDL cholesterol by 29%, attenuated plasmatic triglycerides, and decreased plasma malonylaldehyde, which is a marker of lipid oxidation. All of this published by Soni and Koutian in 1992. Another human study published in 2018 is the one of Thota and co-workers, whereby the intake of 2 capsules containing each 180 milligram of an extract of turmeric given to healthy volunteers before breakfast decreased postprandial glycemia. In simple words, it means the blood glucose you've got after taking a meal, and this decreased by 15.7% at 30 minutes, and decrease of plasma insulin by 26.5%. The decrease of postprandial glycemia is important because decreasing the peak of plasma glucose after a meal will in somehow attenuate postprandial hyperglycemia and postprandial inflammation. What are the effects of taking turmeric curcumin on the blood pressure? We have got some studies on rats given 50 milligram per kilo per day of turmeric, and this was for this resulted into a significant decrease of systolic and diastolic blood pressure. For the systolic blood pressure, we've got a fall from 210 to 120 millimeters of mercury. In type 2 diabetic patients, turmeric given for 3 months induced a decrease in arterial stiffness. This is published by Srinivasan and co-workers in 2019. It's interesting because if intake of turmeric relaxes the vascular walls, it means that it might be able to slow down a bit the stiffness that comes with aging, but these are just inferences. And curcumin given at the dose of 500 milligram per kilo per day for 7 days to healthy individuals decrease blood pressure mildly in a study published by Soni and Koutian in 1992. What about the effects of turmeric on the heart? we have got an animal study done by Mohanty and co-workers in 2004, whereby rats given turmeric orally at a dose of 100 mg per kilo per day for a month had, compared to those untreated, some levels of protection against, very interestingly, myocardial infarction induced by experimental occlusion of the left ascending coronary artery. The effects of curcumin on the gallbladder. Curcumin given to rats as part of 0.5% of diet, high cholesterol diet, was able to increase the fecal excretion of bile acid and cholesterol. A study published by Rao and co-workers in 1970. The effects of curcumin on the kidneys. Curcumin given orally to rats at a dose of 30 mg per kilo per day for 2 weeks to diabetic rats were able to protect kidneys against hyperglycemia, and this was evidenced by an increase of plasma creatinine and urea clearance, and decrease of proteinuria in a paper published by Sharma and co-workers in 2006. Now, in conclusion of this historical and ethnobotanical and scientific evidence, we can see that the intake of turmeric and curcumin seems to be beneficial for cholesterol, high blood pressure, kidneys, and other metabolic syndrome related troubles. But what happened is that, and we all know that this curcumin is not very well absorbed, and in fact, when someone takes 1 gram per kilogram of, in fact, in animal studies, when you give to rats 1 gram per kilo of curcumin, and this is given orally, 75% of this 1 gram will be actually excreted in the feces of rats, whereby a very small amount will be found in the urine in a very interesting study done by Wallström and Beno in 1978. So it seems that curcumin acts on perhaps on the inhibition of cholesterol and perhaps triglyceride absorption by some sort of adsorbing properties or catching activities. In simple words, it's just going to stick to the fats in the gut, and this will be excreted in the fecal matter, and this has been published by Bisson and co-workers in 2016 and Nelson and co-worker in 2017. Also, this turmeric curcumin might be able to aggregate to and stick to all of these biliary sterols, again draining the plasma from the liver and then the plasma from cholesterol. And however, whatever is absorbed of curcumin, some small traces, I think, are rapidly metabolized. But however, in healthy individuals, intake of curcumin at the dose of 500 mg per kilo per day for 7 days after breakfast was able to decrease plasmatic malonidal by about 33%, and this is interesting because increasing the antioxidant capacity of the plasma correlates with a healthier cardiovascular system, because inflammation and oxidations are going to alter the physiological activity of the vascular endothelium, plus many other points. However, curcumin and turmeric have to be handled with care, although it is very popular. I should like to say that handling herbal medicines should be legally the responsibility of a pharmacist. However, the main situation faced today is that in most of the Western world, pharmacy students are not given enough teaching in traditional medicines, in OTCs, and their safeties. It is a trend. I hope that it will change. Pharmacists in their shops should be well trained when it comes to the toxicity and pharmacology and identity of the medicinal plants. I'm aware that in India, in China, for instance, in their schools, they are having an excellent level of teaching in terms of pharmacognosy. And in the case of curcumin, for instance, and turmeric, these cannot be taken by people with gallbladder problem, including obstruction of biliary duct, because turmeric and curcumin stimulate the secretion of bile, and this is found in a book of Zigan 2004. Also quite concerning, there was the case of an elderly man admitted to hospital for bleeding after taking 1 gram, self-medicating himself 1 gram per day of curcumin in a paper published recently by Gronish and co-workers in 2022. Also, curcumin and of course turmeric are able to interfere with the enzymes, the intestinal enzymes, which are responsible for the metabolism of drugs, such as the CYP3A4. And therefore, if you are having some treatments now, some drugs for diabetes, heart problem, or other pathologies, before starting a curcumin or a turmeric regimen, you need to consult your medical doctor. And this CYP3A4 issue has been reported in a paper published by Apia and Opong in 2007. How to take your turmeric? It is better always to try to avoid pure substances when it comes to alternative medicines. It is better to take the raw material itself. For instance, okay, we might speak about this later, but taking some pure substance from medicinal plants as OTC is, in my opinion, can be extremely hazardous. We may speak about this later. So the European Union of Herbal Monograph in 2018 suggests taking for dyspepsia, but this lecture is not about dyspepsia, it is about trying to prevent or mitigate high blood pressure, high cholesterol, and other conditions related to metabolic syndrome. 0.5 to 1 gram of turmeric in 150 ml of boiling water as an infusion 2 or 3 times daily. But this is a bit too much. You may very well take, let's say, 1 teaspoon of turmeric powder in 150 ml of boiling water and take it once a day, for instance, after a meal, your lunch, for instance. And with that, I think that is all, and I thank you very much for your time, and I wish you all the best.